Now we're going to reflect on your transition, chapter 19 of your textbook. We will review your transition through use of the nursing process. First, we have assessment. Reflexive thinking helps develop personal and professional philosophies and is closely linked to critical thinking. Students are encouraged to examine themselves through the new knowledge they have gained. Reflective thinking. It's an effective method for students to develop professional and personal philosophies. It's a dynamic process of analysis that forces the student to examine prejudice, beliefs, feelings, thoughts, and experiences in light of new nursing knowledge. We have critical reflection. The beginning RN should reflect on the interpersonal and clinical skills that are necessary to be an effective practitioner. Students should consider both strengths and weaknesses that can enhance and detract from their plan of action. Professional development means continued education, by which the RN may attain certification status in numerous specialties. Ask yourself questions about your beliefs. Reflect on RN competencies. The ability to recognize problems from presenting signs and symptoms, awareness of the urgency of a situation and acting appropriately to the level of urgency, capacity to design a plan of care that safely meets the needs of the patient, and understanding the nature of the plan of care in relation to the patient's medical and nursing problems, and strong interpersonal and clinical skills. Then we have critical reflection, capitalizes on strengths, and correct weaknesses. Now, making the diagnosis. Review the problem list, identify the reasons for the problem, and develop a plan that focuses on a solution. Prioritize the problems and ask advice from an experienced RN if necessary. Cluster your strengths and weaknesses. Develop a diagnostic statement. Determine a problem's cause. Be honest, and then prioritize. Planning. The new RN should establish long and short-term goals and outcomes to assist in professional development. Personal development should not be neglected because an RN should strive for balance between the professional and personal self. Formulate personal and professional goals that will assist you with the transition into your new role as a safe beginning RN. Determine your short and long-term goals. For professional development, establish yourself as capable, competent, and safe. Act to advance the practice of nursing through your actions and your skills. Implementation. Interventions that help the nurses transition to RN should be expanded to complement new goals. The new RN should communicate effectively with the supervising RN, who can support the novice RN with appropriate patient assignments and experienced advice. Interventions to achieve your goals. These assist you in establishing discipline and dedication to your professional development. Set aside study time. Request patient assignments that will help you learn. Ask mentor or preceptor questions. And work through patient care scenarios. At first, consider what your previous LPN duties would have been, and then envision how your role expands or changes within the scenario as an RN. You may want to transfer to another unit or job. Your new tools. RN should maintain expertise and competency in all necessary nursing skills, even those that are used infrequently. Knowledge, skills, and values. So what's stopping you? The new RN may discover barriers to the role as RN. Anxiety about decision making, clinical skill level, and supervisory duties can be a formidable barrier. Confidence will come with time and experience. Are these barriers that keep you from moving fully into the RN role? Change can provoke anxiety. Confidence will come with experience. Evaluation. Evaluate emotional readiness, level of confidence, and support systems to assess the effectiveness of the transition to the role as RN. Evaluate the effectiveness of your efforts to become an RN. Take an emotional inventory. Take a confidence inventory. Use support systems. Evaluate your journey through the transition from LPN to RN and reflect on your journey as a means to identify your philosophy of nursing as an RN. In the end, do what you were called to do the best of your ability. Okay, so practice question 1 for evaluation. What can the LPN use to reflect on the transition to becoming an RN? Is it the teaching learning process, the nursing process, the self-care process, or the decision-making process? Oh, this is an easy one. I think I gave it away in the very beginning. It is number 2, the nursing process. You learn to apply the nursing process to your own transition to your new role as an RN. This concludes this lesson.